Vagus nerve as modulator of the brain-gut axis in psychiatric and inflammatory disorders. This was published in Frontiers in Psychiatry, published online March 13, 2018. This is published in the National Library of Medicine, National Institute of Health. Vagus-related treatment in inflammatory disease. This is part 5. Pathophysiology of irritable bowel disease. Inflammatory bowel disease comprises mainly 2 disorders: ulcerative colitis, UC, and Crohn's disease, CD. The hallmark of IBD is chronic, uncontrolled inflammation of the intestinal mucosa. Symptoms are characterized by abdominal pain, diarrhea, fever, weight loss, and extraintestinal skin, eyes, joints manifestations. In Crohn's disease, the predominant symptoms are diarrhea, abdominal pain, weight loss, whereas in ulcerative colitis, diarrhea is the main symptom, often accompanied by rectal bleeding. Inflammatory bowel disease affects about 1.5 million persons in the U.S. and 2.2 million in Europe. And about 20% of inflammatory bowel disease patients have a positive family history. In addition, industrialization has led to marked increases in IBD prevalence rates in Asia. There is increasing evidence that environmental risk factors, including infections, Western diet and food additives, air and water pollution, drugs, antibiotics, hormones, and psychosocial stress work in concert with genetic factors. More than 250 genetic factors have been consistently identified in the pathogenesis of IBD, finally leading to an abnormal immune response in microbial exposure. What distinguishes IBD from inflammatory responses seen in the normal gut is an inability to downregulate inflammatory responses, like it happens when intestine becomes inflamed in response to a potential pathogen. Thus, in individuals with IBD, inflammation is not downregulated. The mucosal immune system remains chronically activated, and the intestine remains chronically inflamed. During inflammation, pro-inflammatory cytokines released from the intestinal mucosa activate VN afferents that terminate in the NTS, then relaying visceral information to activate the HPA axis. Moreover, an anti-inflammatory role of vagus afferents through the CAIP has been reported. As stated earlier, HCH released at the distal end of VN afferents decreases the production of pro-inflammatory cytokines such as TNF. The overexpression of the TNF may present a crucial step in the development of IBD. VNS in inflammatory bowel disease. Vagus nerve stimulation attenuates the systemic inflammatory response to endotoxin and intestinal inflammation. The VNs also indirectly modulates immune activity of the spleen through connections with the splenic sympathetic nerve. In rats with colonic inflammation, the 3-hour-long daily VNS for a period of 5 days led to a reduction in inflammatory markers and an improvement in symptoms of colitis. Vagus nerve stimulation has been of interest in other inflammatory diseases, such as rheumatoid arthritis, another TNF-mediated disease. In patients with rheumatoid arthritis, a study that demonstrated an improvement of symptoms in the early and late stages of the disease through 1 to 4 minute minutes of vagal nerve stimulation daily. This study is also the first to show that VNS inhibits the production of TNF and other cytokines in humans by stimulating the inflammatory reflex, leading to an improvement of symptom severity. These data argue for an anti-inflammatory role of the vagus nerve and provide potential therapeutic applications for patients with IBDs. Positive influence of nutritive components on IBD. Mechanistically, the role of inflammation plays in the onset and perpetuation of psychiatric symptoms has garnered increased attention. The increase of dysfunctional immunological responses in modern urban societies are posited to be, at least in part, associated with reduced exposure to commensal and environmental microorganisms that normally prime immunoregulatory circuits and suppress inappropriate inflammation. The intestinal bacteria flora is thought to be an important factor in the development and recurrence of IBD, and various attempts have been made to modify the flora with probiotics. In animals with experimental colitis, oral and rectally administered lactobacilli have yielded improvements. For example, Lactobacillus plantarum prevented the onset of disease and reduced established colitis. Further, a multi-species probiotic given to mice with established colitis normalized gut barrier function, reduced pro-inflammatory cytokines, and lessened histological disease. In humans, Lactobacillus casei improved symptoms in children with moderately active CD, and in addition, a combination of probiotics with Saccharomyces boulardii, Lactobacillus, and VSL number 3 showed slight improvements of CD symptoms. These data are preliminary and need confirmation by future studies. So far, no probiotic treatments have been officially recommended for the treatment of CD. In UC, there is reliable evidence of VSL number 3 to be beneficial in the treatment of mildly active pouchitis. E. coli Nissel, part of VSL number 3, may be effective as a drug mesalamine in maintaining remission. Positive influence of hypnotherapy, meditation, and yoga in IBD. An increasing number of studies have shown benefits of relaxation-related treatment of IBD. For example, a randomized controlled trial of relaxation training interventions compared to a control group has shown decrease in pain as well as decreased anxiety levels and improvements in quality of life. Also mindfulness-based therapy, a comprehensive mind-body program, meditation, and mind-body alternative approaches, yoga, and relaxation response-based mind-body interventions have shown to be beneficial for IBD patients. In addition, hypnotherapy, which increases vagal tone, has been effective in treatment of IBD. Conclusion: the interaction between the gut and brain is based on a complex system that includes not only neural, but also endocrine, immune, and humoral links. The vagus nerve is an essential part of the brain-gut axis and plays an important role of the modulation of inflammation, the maintenance of intestinal homeostasis, and the regulation of food intake, satiety, and energy homeostasis. An interaction between nutrition and the vagus nerve is well known, and vagal tone can influence food intake and weight gain. Moreover, the vagus nerve plays an important part in the pathogenesis of psychiatric disorders, obesity, as well as other stress-induced and inflammatory diseases. Vagus nerve stimulation and several meditation techniques demonstrate that modulating the vagus nerve has a therapeutic effect, mainly due to its relaxing and anti-inflammatory properties. Extinction paired with VNS is more rapid than extinction paired with sham stimulation. It's currently approved by the federal FDA for depression and seizure prevention, VNS is a readily available and promising adjunct to exposure therapy for the treatment of severe anxiety disorders. Vagus nerve stimulation is an effective anticonvulsant device, and also shown in observational studies antidepressant effects in chronic treatment-resistant depression. Because the vagus nerve sends information to brain regions, it's important in the stress response. The orbitofrontal cortex, the insula, hippocampus, and amygdala. This pathway might be involved in perceiving or manifesting various somatic and cognitive symptoms that characterize stress-related disorders. Psychotropic drugs such as serotonin reuptake inhibitors have effects on both the brain and the gastrointestinal tract, and consequently should be understood as modulators of the brain-gut axis. Research investigating the interaction between nutritive factors, somatic factors such as heart rate, psychological and pharmacological treatments, and vagal activity has the potential to lead integrative treatment options that incorporate VNS, nutritional approaches, drugs, and psychological interventions such as mindfulness-based approaches, which can be tailored to the needs of the individual patient.